So when the patient arrives at Cascade Eye and Skin for an initial LASIK consultation, they're usually greeted by a cheerful front desk who's very competent and welcoming. Once the patient is brought into the exam room, the technician prepares the patient and discusses matters pertinent to the following examination. Once the ophthalmologist arrives in the exam room to greet the patient immediately realizes that this will be the surgeon as well and the person who carries out the follow-on care. This relationship is a strong bond and the examination will be thorough. The examination includes a discussion about the goals of the patient, the needs of the patient, and the capabilities of the LASIK surgery and how it relates to the patient's needs. Once an initial discussion has been had, the ophthalmologist then examines the anterior surface of the patient's eye and does a thorough refraction. This is used to match with the wavefront guided refractive system that the laser uses to create the visual correction. After this initial portion of the examination, the patient is dilated. Dilation usually takes approximately 10 to 15 minutes, and this permits a different type of refraction called a cycloplegic refraction. This again is used in order to be precise with the treatment profile. It also enables the ophthalmologist to have a dilated examination in full view of the posterior portion of the patient's eye to ensure that the patient's eye is healthy and ready for surgery. Once this is performed, the examination portion has concluded and now the discussion begins. At no point is there any pressure for any patient to go forward with surgery. All questions will be answered, and then even more information about LASIK surgery will be provided to the patient. Once the patient departs the clinic, every patient is telephoned by our LASIK coordinator in order to answer any further questions or to schedule LASIK surgery as the patient desires.
Hi, my name is Keith Dahlhauser. I'm an ophthalmologist here at Cascade Eye and Skin. I've been at Cascade for about 14 years now. Before that, I was at Madigan Army Medical Center. I helped start the refractive surgery center at Madigan, and then now for the last 14 years here at Cascade, I've been doing LASIK and PRK surgery for patients to help them eliminate the need for glasses. So a patient checks into the front desk, signs all the consent forms, and they can take their Valium to relax them. And then when it's their time, we bring them back into the operative area. We'll do a wave scan, so they have to be out of the contact lens for 2 weeks ahead of time so we can get the most accurate wave scan. That wave scan's put on a little digital chip that we bring over to the laser, and then that's the prescription that gets removed from their eye based upon that scan done the day of surgery. That's why we want their eye to be as perfect as it can be the day of surgery. We put some numbing eye drops on their eye, lay them down in the operating table, have some little balls for them to hold on to so they can squeeze if they're stressed. Then we clean up around their eye with some betadine, put some little sticky drapes on their eyelashes to keep them out of the way. And then we have a lid speculum that holds the eye open. It kind of stretches it open wide so the patient can't blink even if they wanted to blink. So that's a little bit annoying, but it's not too bad. And then comes the hardest part of the surgery, which is a suction device we put on the eye that feels like we're pushing really hard on the eye. It's not a sharp pain, it's a pressure pain. But that's what the Valium's for, is to kind of take the edge off so they don't feel that so much. We move over to the intralays to make the laser flap. You don't feel the laser, you don't feel sharpness, you just feel the pressure as you're breathing steady for that whole minute. And then we let go of the pressure. The rest of the surgery is not so bad. We move you back over to the Vizix laser, lift up the flap that was created with the first laser, and then the prescription comes off underneath that flap. During that treatment, there's a red flashing light that you look at in the middle of a white circle. So you just keep your eyes steady looking at that red flashing light. The treatment usually lasts a minute or less. Put the flap back down in place, let it sit for a couple minutes, and then we're done with that eye. We move from one eye to the other eye. It takes about 10 minutes per eye to do. Then when we're all done, we take a look to make sure all the flaps look good under the microscope, and you're good to go. The whole experience for the surgery is about an hour after you check in and the time you leave.
All right, congratulations, you're done with LASIK. I'm going to bring you next door and introduce you to one of our technicians that's going to go over your post-operative care. And don't worry, it's all written down, so when you get home, you won't forget. As we talked about, go home, keep your eyes closed. In about an hour to 2 hours, you're going to have some mild to moderate discomfort. Tylenol, Advil, keeping your eyes closed, it'll get better. Vision, if you do open your eyes, it's going to be clear but kind of foggy. Don't enjoy it today, wait until tomorrow. They're going to go over your drops. Continue the drops just like we tell you. Artificial tears you cannot use enough. For the little discomfort, Tylenol, Advil. If you have any concerns, give us a call. There's someone on call 24 hours a day, 7 days a week. That's why we're here. That's why it's good to come here, because you'll talk to one of our doctors. Tomorrow, we'll make sure that the flap is right where it is, that there's no wrinkles, that there's no infection, that your vision is getting better. We'll go over how to take your drops. We'll remind you of what you can do and what you can't do. And most importantly, we'll make sure that your surgery is doing great, and then we'll usually see you about a week after that.